everybody. My name is Sini. Today I would like to talk about the postoperative care of cataract surgery. Before I explain the postoperative care of cataract surgery, I briefly explain the definition, causes, diagnosis, signs and symptoms, and preoperative care of cataract surgery. Now let us see what is the definition of cataract. Cataract is an opacity within the lens which lead to a decrease in vision. And next we will see the causes. What are the main causes of cataract? Is the age. It is an age-related disorder. 85% of disease is age-related. Trauma, radiation, genetic, skin diseases, drug uses, medications, other diseases like hypothyroidism, hypertension, diabetes may lead to cataract. Next is what are the signs and symptoms of cataract? Cloudy or blurred vision, sensitivity to light and glare, frequent prescription changes for glasses or contact lens, poor night vision, color vision changes and diminishing, double vision in a single eye. Next we will see what are the diagnostic measures of cataract. History and physical examination, visual acuity measurement, ophthalmoscopy, slit lamp microscopy, glare testing, keratometry and ultrasound. These are the main diagnostic measures for find out cataract. Treatment. In the beginning stage of cataract, the vision may be slightly improved using form of visual corrections, but in later stage, surgery is required. Next we will see preoperative care of cataract surgery. An appropriate history and physical examination is very important. Consent should be taken and all lab studies should be done before the surgery. The surgeon may order preoperative antibiotic eye drops, and client should not take a food or fluid approximately 8 hours before the surgery. The nurse will instill dilating eye drops and non-steroid anti-inflammatory eye drops, and patient should be admitted surgical facility on outpatient basis. To give appropriate anti-anxiety medications before the local anesthetic injections. Next we will see postoperative care of cataract surgery. Same like any other surgery, close observation should be done immediately after surgery. The vital signs should be checked every half an hourly, and patient should be watched closely at least 4 hours. And we should always advise the patient to minimize the head movement, because increased movement may lead to increased intraocular pressure and other complications. Eye shield. Patients are advised to use eye shield for protection of the eyes when they sleep, and they may wear dark glasses during the days. We should always advise the patient to wash the shield and eyeglasses with soap and water and dry them same before use. Washing the face. Cleansing the operated eyes will be as per the instruction given by the doctors. The rest of the face can be mopped with clean and wet cloth, and avoid flushing water into the operated eyes. Shaving is permitted after operation, but avoid flushing water after shaving. Instead they can clean with clean and wet cloth. Bathing. Patient always can take body bath after the first day of post-operation itself, but they should avoid head bath at least 3 to 4 weeks. Use of facial cosmetic. Avoid cosmetic to eye such as mascara, eyelines for at least 4 to 6 weeks. Physical activity. Activities such as walking, jogging, TV viewing can be resumed immediately after surgery. However, Jogging, swimming, gardening, sports may have to avoid until 4 to 6 weeks after surgery. Next is driving. Driving should be avoided till your surgeon give you permissions. Joining back to the duty. Patient can join to the duty after 4 to 6 weeks depend upon the surgery, and patient may resume the sexual life after 2 weeks of surgery. Next we will see the procedure of cleansing the eyes. The operated eye need to be cleansed at least twice a day. The patient or attendant who were performing this procedure should be wash their hand with soap and water and dry them with a clean towel. Cleansing the lower lid of the lower lid eye is done by asking the patient to look up and wiping all secretions in the lower eyelid margins. The same way cleansing the upper lid is done by asking the patient to look down and doing the similar procedure. Similarly, outer and inner corners of the eyes are to be done. Next, instilling the medicine in the eyes. The hand hygiene is very important. The patient or attendant who are performing this procedure should be washed the hands with soap and water. The cap of the eyedropper bottle is opened carefully with contaminating the tip of the nostrils. Pull the lower eyelids and place the drop between the eyeball and eyelid. The squeeze the bottles 1 to 2 drops. Wipe away excess medicine that may stick out. And always instill drop before ointment. Leave gap of 5 minutes between 2 medications. And keep the eyes closed for 5 minutes after applying the medication. Once opened, the eye drops are discarded after 10 days. Replace the cap of the bottle immediately after use. Make sure that the right drops being used for the right number of times. If similar medication is advised for both eyes, it is advisable to have a separate bottle for each eye. And unused eye medications once opened is discarded and never used for any other persons. Next we will see about the general instructions. Should not rub the eyes, should not lift heavy weight, do not allow the eye to get injured. The patient should always use eye shield or dark glasses protect the eyes. And avoid too many visitors, fear of contacting infection, especially avoid visitors with conjunctivitis and cold. Do not play with children, there is chance of getting injury to the eyes. Should not strain the toilet. If needed, should be used laxative. Should be avoid alcohol and smoking, and avoid using handkerchief to mop the eyes. Use sterile tissues only. By this I conclude my topic. I think everybody understood the topic, and thank you for your time. Thank you very much.